Hello, this is Dr. John from Gateway to Wellness, and we're here for another interview today to help to introduce you guys to some of the different practitioners around the community that can get you back to getting healthy and to doing the things that you love. And so today we have Dr. Lance Berry from Envision Rehab and Performance here in Cedar Park. And so Dr. Berry, thank you for coming on here with us.
Absolutely, my pleasure.
And tell us a little bit about yourself.
So I opened Envision Rehab about a year ago, and I've been a physical therapist for about 8 years. So I primarily work in the outpatient setting, outpatient orthopedic, and that's generally the population that I serve. So.
Awesome. So tell me what got you into physical therapy.
So back when I was in high school, I knew I wanted to do something in the medical field. So, and I had an interest in that. So, I decided to pursue physical therapy. My family was my brother and my dad were both getting therapy, and I could see, the benefit of it. And I was very interested in it. So I decided to really pursue it, and here I am.
Awesome. I can understand right there. I actually was on that same path. I played football through high school and college and had been through quite a few physical therapist offices, and that's kind of the path I was on, and kind of directed a little bit different over to chiropractic, but definitely I appreciate all that you guys do over there. So tell me especially right now, we're going through a different season than what we've ever seen, where we're in 2020 for anybody who's watching this in the future. We just barely are getting through COVID-19, and there's been a lot of change going on with people for a while there where they weren't getting active, and so there's a lot more, especially your chronic injuries and stuff, they're popping up in people. But also a lot of people now, they're trying to get back active and noticing all that stuff that's accumulated over that time. So tell me, what are some good things that people can start doing to get back moving, get back active, and be able to get back to that active lifestyle?
Yeah, I would say trying to change up your position, every 30 minutes or so. So say a lot of people are working from home, and they're at a computer, they're homeschooling their kids. So, getting up, going for, a 5-minute walk, or even if you don't have that much time, just performing some squats up and down out of your chair, 15, 20 repetitions to get your heart rate up, and then kind of get back to what you're doing. But yeah, just the biggest thing is not spending prolonged periods in one stationary position.
That's very true. We try to talk about that a lot in our practice here about movement.
Yeah.
We talk about movement all day long, but I like how right there we try to emphasize too, it's not the going out there for hours at a time to a gym, which makes it so people get pushed away, but more just those little things that we do throughout that time. So tell me a little more. We all heard physical therapy. Some people haven't had a chance to be to a physical therapist, but tell me what are some things that you do to get people back to doing the things that they love?
Right. Yeah. I'll see people, they'll come in and they, they're not realizing it, but they're not moving, quite right. So sometimes it's just like changing up, people's body mechanics as they're doing certain activities to, take some stress off the joints. And then, doing some different techniques to restore the mobility of those joints can really help people begin to have more pain-free, normal movement and, mechanics. So just kind of teaching people how to move and trying to get them to move correctly to reduce the risk of those, those overuse injuries.
That's a huge thing, especially the moving correctly, because we see it all the time, especially with people that come in here with chronic pain. I always tell them a lot of the patients we see are broken kids that turned into adults. Just because a lot of people have things that happen way earlier in life, and they don't take that time to go through the right rehab or the right things to where they get moving properly. So that now turns into your major things that turn into your chronic problems over time. So
sometimes we even have to change how people are walking and things like that. So yeah.
Very, very true.
Yep.
So tell me with that though too, with that topic we were talking about, why is it so important to actually fix the issue instead of just pushing through and temporarily easing the pain and to where we can get back?
Right. Yeah. Oftentimes, if you just let it linger, it'll kind of slowly worsen over time. So if you can nip it in the butt early on, then you're less likely to have it turn into a problem that's either constant or even more nagging. So yeah, the sooner you can take care of those little aches and pains, the better off you're going to be.
Awesome. So tell me kind of there's lots of different places that people can go to get help. What kind of differentiates your practice from others around the area?
Sure. So here at Envision Rehab, we focus on one-on-one treatment with a doctor of physical therapy. So, some high volume clinics are having to maybe pass you off to an aide or someone with not as much expertise. So we try to really focus our time and attention on one person at a time. That way we can devote all of our attention to one person during, because the patient's time is valuable as well. So I want them to feel like they are getting, their time well spent while they're here.
Very, very true there.
Yeah.
All right. So tell us kind of how can people get a hold of you if they have either any questions or need to actually get rehab from an injury or from surgery or something like that? How can they talk to you?
Yeah. So the best way is to call 512-925-8857, or if you want to just kind of learn a little bit more about Envision Rehab and what we offer, another good thing to do would just be to visit our website, www.envisionrehabandperformance.com. It's a little lengthy, but yes.
All right. We'll make sure to list it here on this too as we get this out.
Yeah.
All
So
right.
yeah, the website or the phone, it would be best.
All right, perfect. All right, well, thank you for coming on here for us today and for providing those insights for our clientele and our community here in the area.
Absolutely. My
And
pleasure.
anything there is that we can do for you in the future, though, too, tell us, and we will be glad to help out through there.
Excellent. Thank you.
All right, thank you once again. This is Dr. John, and helping you get back to what you love.